In the upper third of the face, you typically will see the droop of the brow and the upper and lower eyelids. And to improve those areas, we have the brow lift to basically raise the brow to its appropriate position, the upper and lower eye lift, which will appropriately position the soft tissues there, get rid of a lot of the bags and sags that we often see. In the middle third of the face, we will see the cheek lift being an excellent adjunct to some of the other procedures we provide, and of course the rhinoplasty to reshape the nose. And for the lower third of the face, the more common things that are done that are very effective from a surgical perspective are the different facelift techniques. There are different techniques based on the aggressive nature that you would want. In terms of people that come in that are perhaps younger in age and don't have a whole lot of fullness to the neck and jawline, they may be a good candidate for a mini facelift. And mini facelifts are done oftentimes in an office setting. In my practice as a board-certified facial plastic surgeon, I have certain techniques that may be a little bit more advanced than what others may provide in an office setting, such as liposuction or liposculpting of the neck, which is done often in conjunction with the mini facelift. So that's the less aggressive approach, where the incisions are hidden very well around the ear. Less of the tissue is elevated in terms of the mini lift, so that way the healing process is quicker, and of course the amount of tissue that you manipulate is less, so results are achieved faster. The second step would be the direct neck lift, where you're just specifically focusing on the neck alone, and some men are good candidates for this, where basically the muscles and the soft tissue is tied together in the anterior neck and the front neck portion, and that provides an excellent result if we're not too worried about the jawline. Now the final, of course, is the full facelift for some folks that have a lot of fullness in the neck, very heavy jowls. Those people are excellent candidates for a full facelift technique. As far as the non-surgical options nowadays, because people are very active in their lifestyles, we have a vast array of those techniques as well. The quote-unquote no downtime procedures are very, very popular nowadays, and they range all the way from Botox to fillers to laser treatments. Botox basically weakens the muscles, and I try to use it typically in the upper third of the face, where people will have deep furrows in their, in the center of their forehead. Typically the moms that have unruly children will often come in with those. Relaxing those muscles will take care of a lot of those deeper furrows. Fillers are a good adjunct in that area. If the furrows are very deep, in spite of the muscles being relaxed, sometimes they don't go away altogether, and the fillers just build the volume back where it is now gone. In terms of the brand names, there's Restylane and Radiesse and Juvederm and Sculptra, among others, and they all work well, but they have to be used in the appropriate area by somebody that's qualified, and certainly somebody that does this very frequently in their practice. Now the last thing is, of course, the lasers that we mentioned. A lot of them are for scars, a lot of them are for resurfacing. There are the photofacials that are often talked about. There are nowadays the fractional lasers that are very common. Fortunately, with our new building, with the Bella Vista Building, and providing a state-of-the-art facility, we've invested in a lot of new lasers that have really augmented our practice capabilities substantially. And we have all of the lasers that I mentioned available to us. We even have lasers that are useful for spider vein treatment and for basically enhancing the collagen production in the skin, along with some of the other resurfacing lasers that I mentioned. From my perspective, I do not only aesthetic surgery, but a lot of reconstructive surgery. I do all the cleft palate and lip repairs in our area. And I find that along with the head and neck tumors that I remove and reconstruct, and the traumas that I rebuild, the fact is, you have a good understanding and a good concept of the anatomy, and the ultimate results, even if it's an aesthetic procedure such as fillers or Botox, if done in the right hands, in the right setting, and in the hands of a physician that has done a multitude of more involved procedures, the rest is very much smooth sailing.